let's get started. Again, good morning, good afternoon, good evening, depending on where you are. Buenos días, buenas tardes, from Montreal, Canada. Welcome to the webinar From Waste to Wellness, Leveraging Nutrition and Cooking for a Healthier Future. We're really excited to welcome you today and in the context of the Food Waste Prevention Week. We've been partnering and collaborating with them for the last few years, and we are really excited to welcome Lorena Macias and Ana Leiva with us today to help us to better understand the linkages between nutrition, health, and food waste. My name is Antonia Andugar. I'm project lead at the CEC, at the Commission for Environmental Cooperation. And first of all, I'd like to give you a bit of housekeeping details. First of all, we are happy to provide simultaneous interpretation in English, Spanish, and French. And we invite you to click on the globe icon at the bottom of the screen and select your language if you want to follow the webinar in English or in French or in Spanish. If there's no globe, you can click on the three dots and choose interpretation and select the language there. My colleague Andrea will put these indications in the chat for the participants who will be joining in a couple of minutes. You are invited to say hello in the chat box and also to put your questions to the panelists in the Q&A box. So you will have different boxes with different purposes. We will go through the questions after the presentations, so you can write them as the webinar goes on. So you don't need to wait till the end to put them there, but we will formulate them at the end. Each presentation will last about 15 minutes, and we hope to have the rest 10 minutes for these questions from your side. We will be sharing 4 polls with very interesting facts that we'll put on the screen throughout the webinar. To reply to the questions, either you can scan the QR code that will appear, or use the link that will be in the chat, and you will see it appearing on the right side of the screen in a box, like a chat box. The PowerPoint presentations and the recordings in the 3 languages will be available on our website's event page in a few days, and we will send you an email after the webinar. So you will find the link there to go to the events page. And also we'll be very thankful if you can fill out the survey after the webinar, either using the QR code that we will share on the screen or using the link that you will have in the email we will send after the webinar. So I hope this is helpful for everyone. And again, we're very excited to host this webinar. We are really thankful to Lorena and to Ana. And to start with, I would like to say that we have more than 200 participants registered. Most of them are from Mexico, most of you. So I will be switching from English to Spanish, and our amazing interpreters will help us all to follow the content of this webinar. So with no further ado, I will ask my colleague to go to the first slide of my presentation. Please, Eleanor. Thank you. For those of you who are not familiar with the CEC, just to tell you that we are already 30 years old. The Commission for Environmental Cooperation was created along with the signature of the former NAFTA, the North American Free Trade Agreement, back in the 90s. And in parallel, the countries signed an agreement on North American environmental cooperation. And the mission is to facilitate effective cooperation and public participation to protect our common environment. And we are funded by the 3 governments from Canada side's Environment and Climate Change Canada, US, the EPA, the Environmental Protection Agency, and from Mexico, Semarnat, la Secretaría de Medio Ambiente y Recursos Naturales. Next, please. When we talk about food waste or wasted food, we are talking about a global problem, but of course, very important as well at regional level. And maybe you're familiar with this issue, maybe you're not, but an interesting fact is that 1/3 of our food goes to waste. And that's huge. It's a mountain of wasted food. Here we see some images in the three countries of a youth awareness campaign we launched in 2020 to show how a mountain of wasted food could appear in these cities, which is really shocking. And why does it happen? It happens because we waste food at home, at the school cafeteria, at a restaurant, so many places. And why? It's because the decisions we make. It means that we don't eat the leftovers we have at home, or we buy too many groceries and we don't use it and they go bad in the fridge. So it's really depending on us, the fact that we can prevent food waste. And now I would like to share with you a series of questions to see how familiar you are with the size of the problem. So we will see the questions, sorry, in the screen. You can scan the QR code, or you can see on the right side. And the question, you have it in the three languages. What do you think are the food loss and waste total estimates at consumer level in North America, Canada, Mexico, and US? We are talking about consumers. It means you and me every day at home. So please go ahead. Let us know what you think. If it's 20 million tons per year, 67 million tons, or 15 million tons. So let's see. Okay. Okay, so 65% of participants think that we waste 20 million tons per year. I see you're very optimistic because unfortunately, the right answer is 67. It's a huge quantity. It's really shocking. And 20 million tons, it's at the processing stage. It means manufacturing in the agri-food chain. And 15 million tons is at distribution, at the level of distribution. So only consumers, you see how huge is the mountain of wasted food. And we have another question for you, another interesting fact. Eleanor, please. Yeah. What else do we waste when we waste food? It means that we're using fertilizers, we're using energy, we're using waste, land, etc. So the equivalents are very interesting. Are we wasting an estimated water footprint equivalent to filling 7 million Olympic-sized swimming pools? Or are we using the energy equivalent to powering 200 million homes per year? Speaking per year. Or are we emitting greenhouse gas emissions equivalent to driving 4 million cars? Go ahead, let us know what you think. Let's see the answers. Okay, so we see, okay, most of you think that we are emitting greenhouse gas emissions, which are equivalent to driving 4 million cars 24 hours per day for 1 year. The right answer is not that one, it's the first one. It's the equivalent, the water use is equivalent to filling 7 million Olympic-sized swimming pools. And regarding the cars, it's not 4 million cars, it's equivalent to 41 million cars. So it's even bigger, the carbon footprint. And regarding the energy use to power in 200 million homes, it's 274 million homes could be powered with the energy we spend. Producing food, transporting, and manufacturing, eating, and throwing away the food that we don't consume at home. So I think we have a good overview of the problem. This is at regional level, so in North America, but you can imagine at global level, it's even worse. Let's go to the final slide of my presentation, please. We lost the presentation. Okay, no worries. We'll see it later. I'd like now to invite Lorena Macias. Thank you. Okay, we sit here. So just to invite you after the webinar to follow us on our social media. You can learn more about our work to prevent and reduce food loss and waste. You have two links here. We've been working on education and we've been working on measurement. So you have very nice microsites. You can go through them and to see all our resources. And of course, you have my email address. If you want to contact us, please do it whenever you want. Okay, that's fine. So I'd like to invite now Lorena, our first panelist. Lorena is a Teaching Kitchen collaborative fellow and a third-year doctoral student at the University of Texas Health Houston School of Public Health. Lorena, please, the floor is yours. Thank you.
Thank you very much, Antonia. It's so nice to be in this event. I feel very fortunate to be able to share a little bit of the work that we do at the University of Texas. Let me just share my screen. Okay. As I said, let me just move this. Okay, can you see my screen okay?
Yes, Lorena, yes.
Okay, thank you. So very nice to see y'all. I'm Lorena. I'm a third-year doctoral student at UTHealth, and I will be talking to you about food as medicine and how these initiatives can actually prevent food waste. So the session objectives today, we will be talking about what is food as medicine, what is culinary medicine as well. And then the focus of my talk today is going to be on how food as medicine and culinary medicine initiatives and education can actually reduce food loss and also improve our health. Antonia already addressed this, but in the US, 30 to 40% of the food that we produce goes to waste. And as Antonia perfectly stated, we're not only wasting food, we're also wasting the water that went into it, the labor of the people that helped transform those fruits and vegetables into food, and also the energy. Once you have that waste, there's a lot of energy that is required and water to get rid of that waste. most of the places where food is wasted is at the household level. So we have a huge part on this effort to prevent food waste. And sometimes this food waste is because we don't know if it's safe to store food that we didn't finish. Are we able to freeze certain types of foods? How long are they good for in the freezer? Or sometimes we don't know how to reuse these ingredients. So before I start delving into the main purpose of my talk on defining what is food as medicine, I would like to share a question with you. So if you can help me answer, please, can you share the Slido question? So the question here is, what do you think food as medicine means? So here are the three options. And let's see the answers. Oh, that's perfect. Thank you. I might have made this too easy for you, but everyone is almost correct. 95% of you are correct. So let's go back to my presentation to actually share what it means, but you are already experts. You can come to Texas and work with us. Share. Okay, so food is medicine is in the heart, in the middle of healthcare and food and health. And there are three ways that we can think about what food as medicine is. So, what we're trying to do here in the US is build the evidence base to show that these types of programs improve our health and can actually, as I said, reduce waste. So there are three types of programs that food as medicine encompass. So one is medically tailored meals. So let's say you have a patient that is dealing with cancer. So we develop meals that are tailored for that certain type of disease. Produce prescription programs are when you go to your physician and let's say you're diagnosed with diabetes, the physician can write a prescription for food, a prescription for insulin, but they can also now write prescriptions for healthy food. And medically tailored groceries, what that means is that you are given a list of groceries that are good for you, and you can also get some vouchers to go and buy them at the supermarket. We will go over some examples so it's more clear what am I talking about. So this is the food as medicine pyramid. And as you go up in the pyramid, you go from prevention to treatment. So one thing that is very important is that we can see food as prevention for certain diseases, or once we already have them, it can help us treat those diseases. So let's say if you're diagnosed with pre-diabetes, if you follow a healthy diet, you might not develop diabetes. Let's say you already have diabetes, having a good nutrition can actually help you manage those sugar levels in your blood. And here I want to call your attention in this part because this is our focus today. So when we're talking about these programs, nutrition education and culinary medicine is very important because, for example, I can send you to your house a box of fruits and vegetables, but you might not know how to cook or how to transform those things into a healthy meal. So that is where this component comes into play, right? Nutrition education and culinary medicine. Now, let's talk about culinary medicine. So the definition is exactly what it means. So it's blending the art of the culinary world plus nutrition, the knowledge of nutrition and the knowledge of medicine. So it's a blend of these three areas because nobody wants to eat something like a sad salad, right? Nobody just wants to eat salads all day. So eating is also a very important part of culture and pleasure, right? So we are thinking about ways to make healthy food delicious. and enjoyable, right? And then the nice thing about culinary medicine is that it's very practical. So here in the US, we have some hospitals or clinics that have culinary medicine workshops. So within the hospital system, we place a lot of importance of food as treatment and as prevention of certain diseases. So we show people how to cook with nutrition knowledge, but also we invite chefs to make those recipes very good and enjoyable. Um, so yes, as I said, there are some hospitals that do, for example, a healthy recipe for the month. Um, so it's I can talk more about that in the Q&A if you'd like to learn more. So why are these initiatives so helpful? Well, how can if people are taught how to cook and how to transform those ingredients into healthy meals, there is a likelihood that we will waste less food, right? Also, if we're thinking about planning our meals, that way we don't overbuy things and have them go bad in our fridge or in our kitchen, right? We also can learn how to use certain ingredients because sometimes we can like feel intimidated, right? If we are looking at an ingredient that we've never used, we might just leave it there and then throw it into the trash, right? So these types of culinary medicine experiences and education can actually help you transform these foods and creating them in a healthy way and avoiding food waste. So as I was talking about, this here. So sometimes, especially with little kids, while you're introducing new foods, these types of programs can actually help them to become familiar and embrace these new ingredients. Also to explore, trying new things and enhancing your palate to new flavors. And once you're open to that, you might be less likely to throw food away, right? Because you know how to create foods from scratch, you know how to play with different ingredients. And also, if you have a diverse diet, you will likely get nutrients from other types of foods. So that will also improve your health. Technology is becoming increasingly a part of the way we do our work. I will share very briefly an example of one of the studies that we're currently doing, but chatbots are great source of inspiration. So if you cook something and you have leftovers, you can ask ChatGPT like, hey, how can I transform this into a healthy meal? Or what recipe can you help me make with an orange, some broccoli, and some cheese? And you will be surprised how ChatGPT is so creative like that, and it will let you explore new ingredients. So I, of course, encourage you to, when you're like, oh, I only have these three things in my fridge, I'm just gonna throw them away. Ask ChatGPT for a healthy recipe, or if you're unsure if your food is still safe to eat, also ask it like, hey, I cooked this chicken yesterday. Is it safe to eat today? And I'm pretty sure the answer is going to be yes, if it was refrigerated, right? Sometimes we just throw food away without actually knowing that it's still good to eat. So, of course, food safety is important, but also let's try not to waste as much food because we don't know if it's like still good. So being mindful of that, taking notes, like I cooked this on this day, I froze it. It might still be good for 3 months if it's still frozen. So this is an example of a study that we're doing here at UTHealth in Houston. It's a collaboration with a clinic, a company that gives us the fruits and vegetables. They are called Planet Harvest, and us in the university who are measuring the results. So we have women that are pregnant that come into a clinic. The clinic refers the patients to us, and we send them twice a month a box to their houses, a box with fruits and vegetables to help them during their pregnancy to have better health outcomes and also to help them feel less food insecure because we're dealing with women that don't have enough resources to buy fruits and veggies. The nice thing with this program is that we have a partnership with DoorDash. I don't know if you're in your countries you're familiar with DoorDash, but it's a delivery service um, that like leaves the fruits and vegetables at the women's stores. So it's really nice. So as I was talking about technology, what we did is like we developed a chatbot. So let's say you receive this beautiful, I don't know, let's say these carrots and this squash. You don't know what to do with that. You usually don't eat those. Well, we created this chatbot to help them cook. So you can ask it like, hey, what can I cook with zucchini, or what can I cook with squash or eggplant? And it can help you. And it's designed specifically for these women who are pregnant that have special needs. So it's really nice complement for the program to have this tool that is always available, right? The technology doesn't sleep. So if you wake up at 1 a.m. Hungry, you can ask it to help you create a recipe. And the nice thing is that it's customizable to English and Spanish. So in summary, these types of initiatives can really help people to think about cooking and health and reducing food waste in a different way. It can give people tools to feel empowered, right? That you don't have to be a professional chef to cook healthy for you and your family. And also, if you don't have the training or the inspiration, that's okay. We have tools that are there. The technology is there to help us to amplify these efforts. And at the end of the day, what we're looking for is behavior change at the household level to reduce food waste and also think about food, as I said at the very, very beginning, as treatment and prevention, right? So I am very happy to answer any questions. And here I will leave you with this quote to really let's work together to turn waste into wellness, right? Through food, education, and innovation. It has been my pleasure to share this time with you. And at the end, I'm happy to answer any questions. This is my contact information. I would be happy to get some questions from you. And thank you very much.
Muchísimas gracias, Lorena. Muy interesante y muy inspiradora la
Thank you,
presentación.
Lorena.
Ya hay
Very
algunas
inspiring, your
preguntas en el
presentation.
chat, lo cual es
We already have
magnífico.
questions in the
Invitamos
chat,
a todos los
and we
participantes
invite
a
all the
seguir haciendo
participants to
preguntas para que
continue
yo pueda
asking
responder al
questions
final.
in order
Y
to
ahora me
answer them
gustaría
at the
invitar
end.
a Ana,
And now I would like to
nuestra
invite
segunda
Ana,
panelista.
our second
Ana
panelist.
Leiva Ramos
Ana
es
Leiva
gerente de
Ramos
inversión y gestión
is
social en la
investment
red
manager
BAMX, que es
in
la red de
the
bancos de alimentos de
Ba-
México.
BAMX.
Y es
It's
responsable del programa Comer en Familia. Y nos va a explicar qué es ese
the food
programa y
the,
qué gran labor
the food
hacen
bank in Mexico.
desde BAMX.
BAMX.
Adelante, Ana, por favor.
Ana,
Claro que sí, Lorena. Muchas gracias. Hola a todos y todo y
hello
todas. Muchas
to
gracias por el
everybody.
espacio. Voy a
Thank you
compartir
for the
pantalla.
space, and I'm going to share my screen.
Listo, solo me pueden confirmar que ya vean
Can you confirm if you can see my screen?
la pantalla. Ay, Dios.
Casi, casi.
Listo,
Sí, gracias.
Okay, ready.
súper. Oigan, pues mil gracias. Muchas
Okay,
gracias
thank you
por
very
este
much.
espacio.
Thank you
Estoy
for
muy
this
contenta de
time.
poder
I'm
representar a
very
la red
happy to
BAMEX y
be able
compartirles todo lo
to
que hacemos.
share
Pues de entrada, igual
the
como ya lo
network
compartió
BAMX.
Lorena,
And
en
like
México también
Lorena
nos
said, in
enfrentamos a una
Mexico, we're also
problemática muy
facing
grande que es
a
el
very big
desperdicio
problem,
de los
which is
alimentos,
the
¿no? Casi
waste of
cada año se
foods.
pierden
Every
cerca de
year,
30
we're
millones de toneladas de
wasting
alimento.
30 tons of food.
Y además no
And
solamente se
also,
pierde el alimento,
not only are
esta
we losing
problemática
food,
engloba distintos, pues problemáticas, ¿no? Como la inseguridad alimentaria. En México,
in,
44
but
millones
in
de
Mexico,
mexicanos viven
44
con
million
inseguridad
Mexicans
alimentaria, es decir, uno
live
de
with
cada tres
food
mexicanos.
insecurity.
Y
One of
además,
three
pues es un
Mexicans,
problema que
and
también
this is a
contamina
problem
al
that
medio
also
ambiente, ¿no?
contaminates
El
the
desperdicio de
environment.
alimentos
And food
genera la
waste generates
misma
the same
contaminación que la flota
contamination
vehicular de Ciudad de
than
México,
the
Guadalajara y
vehicles in
Monterrey,
Mexico
que
City,
son las
Guadalajara,
tres
and
ciudades
Monterrey,
más
which
grandes
are the
de
three largest
México.
cities in
Perdemos cientos
Mexico.
y cientos litros de
We
agua,
lose
mismos con los que pudiéramos
hundreds and
proveer a
hundreds
los
of liters of
mexicanos
water,
de agua
and we
durante
can
todo
supply
un año.
water for a
Se
whole year.
pierden recursos
We
económicos
lose,
y
we
demás,
lose
¿no? Entonces,
financial, economic
pues justo los
resources,
bancos de
and
alimentos,
the
pues
food
somos
banks,
organizaciones
which
sin
are
fines de lucro, nos
organizations
dedicamos a
which are
recolectar y a
nonprofit.
redistribuir
We
todo
collect
este
and
alimento que todavía
redistribute
está en
all this
óptimas
food
condiciones de
that
consumo
is
humano,
in good
pero
conditions
por
for
distintos
human
factores ya no se puede
consumption.
comercializar,
But because
es
of
decir,
different
desde
factors, we cannot
estética, que si la
commercialize with
etiqueta
them
del producto estaba
because of the
rota,
label was torn or because
por distintos temas este
different
alimento ya no se puede
topics. This
comercializar. ¿Qué
food
hacemos
cannot
nosotros?
be
Lo rescatamos y
commercialized.
lo
And
entregamos a
what do?
familias en
We
situación
rescue
vulnerable,
it
¿no?
and we
Hoy en día
give it
contamos con
to
59
people
bancos de
with
alimentos con una
vulnerable
cobertura de
situations.
30
We have a
estados, en
coverage
donde
of
ven una
30
manzana,
states
es
where
donde
you
nos
see an apple,
encontramos y donde
and
tenemos
that's where we are
presencia como
located,
Red
and
BAMX,
we
¿no?
have a
Además,
presence.
somos miembros
Besides,
fundadores de
we
la
are
Global
founding
Food Banking
members
Network,
of the
que está
Global
presente
Food
pues en más
Banking
de
Network,
50
which is
países.
present in more than 50 countries.
En el 2024 rescatamos
In
189,000
2024,
toneladas
we
de alimento
rescued
acopiado. Este fue
182
entregado a
million
2.4
tons of
millones de personas, ¿no?
tons of
Sin
rescued
embargo,
waste.
si ustedes comparan con lo que
But if
podemos
you
llegar a rescatar
compare
con todo lo que
what
se
we can
desperdicia,
rescue
sabemos
with
que aún
everything that is
hay
wasted,
muchísimo por
we
hacer
know that
y
there's a
hay
lot
a
of work
dónde
to
más
do,
llegar por alimento y a
and
más familias para,
we
para
can
poder
have
apoyarlos.
more food in order
Pero de
to support
entrada
all
vengo a
these
platicarles
families.
también
But
de
I
comer en
also
familia,
want
porque como
to
Red BAMX
tell
no
you
solo nos
about
enfocamos en el
eating.
rescate y en la redistribución de alimentos, sino que también en el fortalecimiento de nuestras comunidades. Nosotros como bancos de alimentos somos de
We as
las
food banks,
únicas, se pudiera decir, redes de bancos de alimentos que se
we are food
acercan
banks
directamente a
that
las
go directly
comunidades
to the
con las familias
communities
a
with
atenderlas y a llevarles este
families to
apoyo, ¿no?
respond to them
Y sin
and to
embargo,
provide the support.
Ana,
However,
perdóname, soy Antonia, discúlpame que te interrumpa. Para ayudar a las intérpretes,
um,
¿podrías hablar un poquito
can you
más
please
despacio, por favor?
speak a little bit slower in
Te lo
order to
agradecemos.
assist the interpreters? Thank you.
No
¿me
te
escuchan?
escuchamos. Ahora sí,
¿Sí?
gracias.
¿En dónde me corté? Perdón.
Cuando yo te he interrumpido, ahí ya se dejó de escuchar.
Una disculpa. Bueno, como les comenté, nosotros somos de las únicas redes de
We
bancos de
are
alimentos
one
que nos
of the
acercamos directamente a
few
las familias y es
food
ahí en
banks
donde
that go
nosotros llevamos
directly to
este tipo de
families, and this
programas
is
y
where we take
proyectos
these
para
type of programs
fortalecer
and
las
projects in order to
capacidades, ¿no?
strengthen the
Y es justo donde nace
capabilities.
Comer en
And
Familia.
this
Este
is
video por
where
ahí en el
Comer
chat
en
les van a
Familia
compartir el
or
link
Eat with
para que puedan
Family is
conocer un
born.
poco más del video
This
y el por qué lo
can
estamos
know more
implementando,
about
¿no?
this.
Comer en Familia nace a través de la
To
iniciativa de
Eat
un
in
banco de
Family
alimentos
is
en
a food
México
bank initiative in
con
Mexico
respaldo académico de una
with
universidad.
support
Por
from
ahí nos
the
enfrentamos
academia
a este
university.
problema en donde el
We see
70% de
this
los
problem where
mexicanos no
70%
consumen
of the
fruta y
Mexicans
verdura.
do
Entonces,
not
uno de los
consume
principales alimentos
fruits
que
and
rescatamos
vegetables.
en la
And
red
one of the
BAMX es
main
fruta y
products
verdura del campo,
that we
fruta de
rescue
calidad,
is
llena de
fruit and vegetables
nutrientes,
from
y de pronto
from
percibíamos
agriculture.
cierto
And
rechazo o
we
resistencia al
see
consumo por distintos factores, desde que no sabían cómo
they
prepararlo,
didn't know how to
por el
prepare
poco acceso
fruits
que
and
tienen a
vegetables
este tipo de
because they don't
alimentos en
have
sus
access to
comunidades.
this type
Nosotros
of
llegábamos
foods in
con
their communities.
champiñones
We
y
would take,
creían
for
que era un
example,
alimento
mushrooms,
venenoso.
and they thought that it
Llegábamos con
was
calabaza y
something
no
poisoning.
conocían qué era la
We
calabaza. Llegábamos con
took squash and they didn't know the
berenjena,
squash,
no
or
sabían cómo preparar
eggplant
la
and they
berenjena,
didn't
¿no?
know how to
Entonces, por
prepare
esta
the eggplant.
desinformación
Because this
desarrollamos todo
misinformation,
un
we
protocolo de
developed a
con la
complete
mano de la Universidad de
protocol
Monterrey para
together
entender
with the
un
University
poco
of
el
Monterrey in
contexto de
order to
alimentación
understand the complex in
de los
food,
mexicanos, ¿no? De por qué no
the
estábamos
food and
aceptando
how the
correctamente
Mexicans
estas frutas y estas
uh,
verduras, y es por eso que se
take
crea
advantage
Comer
of
en
food.
Familia.
And this is
Durante
why
el
we
primer año del
created
programa hicimos
Comer en
todo un
Familia or
pilotaje
Eat
de
with the Family.
implementación
We had
con
an
100 familias
implementation
en
program
donde
with
llevamos
100
estas
families
prácticas
where we put
alimentarias
these
para
food
darles
practices
todas las
in
herramientas
order
para
to
que ellos
provide all
aprendieran a
the tools
preparar
so
los
that they could
alimentos que
learn
les
how to
estábamos
prepare
entregando
the
y a
food
su vez
and at the
evitar el
same time
desperdicio de
to
alimentos en
prevent
casa, ¿no? Porque
food
justo
waste
también
at
tenemos
home
esta parte, no
because we
solo
have this
se
part.
desperdicia alimento en
Not
toda su
only
cadena
are they
de
wasting
valor,
food
sino también en
in all the
casa
food
nos
chain, but also
enfrentamos a
at
esta
home
problemática
we are
que es
facing
el
this
desperdicio de
problem,
los
which
alimentos.
is the waste of food.
Entonces, ¿de qué va a comer en
So
familia?
What
Comer en Familia
is
es un modelo de
all Comer en
educación
Familia
en la
about?
alimentación.
This
Implementamos
is
la
a
red de bancos de
program
alimentos
of
en donde
implementation where
promovemos
we
la adecuada
implemented the food
selección,
bank and
preparación
we
y
give the
utilización
selection,
de alimentos
preparation, and the
locales, ¿no?
use of
Todo
local
esto con el
foods
propósito de
with the
lograr un
purpose
cambio
of
en las
being
prácticas
able to
alimentarias de los
accomplish a
beneficiarios
change
que tenga un
in the
efecto a
food
largo plazo y que impacte en su
intake
estado
of all
nutricional y
the
sobre todo en la
people who
salud
we connect,
de las
and
familias,
especially
¿no?
to improve
¿Qué
the
es lo que
health of
buscamos con el
families.
programa? Una,
What are we
facilitar
looking
toda
for
la
in the
información
program?
a los
To
beneficiarios de los
facilitate all the
alimentos que están
information
recibiendo. De
to the
pronto, como les
people who
mencionaba, por
benefit
desinformación,
this food.
estos alimentos no
Because
se
of lack of
consumían o no
information,
se
this food
preparaban de
was
la
not
manera óptima. ¿Para qué?
used.
Para que estos
Uh,
nutrientes
why?
impactaran en la
So
salud
that
de
these
ellos y de sus familias, ¿no?
nutrients would
La
be
otra es mejorar
impacted by
las
them.
habilidades para el manejo de los
And to
alimentos, es
improve,
decir,
uh,
aprenderlos a preparar y
improve
a cocinar
how
de
they
manera óptima.
prepare
¿Para qué? Para
food
poder
in
conservar y
order to
aprovechar
be
los
able to
nutrientes que tienen
preserve
todos
and
los
take
alimentos
advantage of the
que les
nutrients that
entregamos.
all the food that we
Otro de los
deliver
puntos es
have.
que las
Another thing
familias
is that
construyen
the
su propio
families
conocimiento con la
should have their
información
own
proporcionada en los
knowledge
talleres. Este
with
programa
information that is provided
se
in
basa en
workshops.
psicoeducación.
This
Lo que
program is
buscamos en
based on
psicoeducación y en constructivismo.
psycho
Lo que buscamos es que ellos construyan su propio
education. We
conocimiento con la
want them to
información
have
que
their
nosotros les
own
estamos
knowledge
dando y
with
que
the
lo pongan en
information that we
práctica
are
en casa,
provided and to
sin
put it
satanizar,
in practice
sin decirles que lo que
in
están
at
haciendo
home
está mal, sino
without
al contrario,
not telling them that they're
compartiendo y
doing things wrong,
exponiendo
but
todos en
sharing
comunidad.
and exposing
Y bueno,
everything
pues al
in the
final lograr
community.
comer en
And at the
familia. Es
end,
por
be
eso
able
que
to
el programa
comer en
lleva este
familia
nombre y
or eat with a
sabemos que hoy en
family
día todas
has this
estas
name.
prácticas y
We know
costumbres que
that all these
teníamos de comer en
practices and
familia,
customs
en
that we had of
sentarnos, en
sitting
convivir,
down and eating with
en
the
aprovechar la
family and
gastronomía,
to take
alimentos
advantage of
locales, se ha ido perdiendo con el
culinary,
paso de los
we are
años y que de
losing it
pronto ahorita
because of
los
the
tiempos para las familias,
as
entre
time
que el
goes by,
trabajo y demás, es
because
muy
of work
complicado,
and the families
pero
have many
tratamos también de
activities. It's
tener
very
como este
complicated, but
acercamiento con
we
ellos.
try
¿Para
to
qué? Para que
have
sea una
this
experiencia
closeness
bonita
with
y
them
sea
so that it's a
favorecedora
beautiful
para todos.
experience and that it's good for
¿En qué
everybody.
consiste el programa Comer en
What
Familia?
is the
Son
program
recetas
Comer en
basadas en
Familia
vegetales. Todas
about?
las recetas
These
que integran
recipes
estos
are based
talleres
on
son basados en
vegetables
vegetales,
and
optimizan
they are
nutrientes, son de
based on
bajo costo y
vegetables.
sobre todo
They
son ricas
optimize
y
nutrients.
prácticas, ¿no?
They
La
are
duración
very
del
rich
programa es
and
de un año.
practical.
Cada
The
15 días se
program
implementan
has a
talleres de
duration
cocina
of
en
1
las
year.
comunidades, en
We
donde
give
los bancos de
classes in the
alimentos llevan
communities
todos
where
los
the food
utensilios de
banks
cocina
take
y
all
mesas de
the
trabajo. ¿Para qué?
kitchen
Para que las
uh,
familias puedan aprovechar el taller
equipment
y lo puedan
and
llevar a
they
cabo.
can
Son
carry it out,
24
and we
talleres
teach
en
them
donde
how to cook.
participan activamente
24
25
workshops,
a
and we have from
a
25
30
to
personas.
30 people
Entonces, en 30
participating.
minutos
In
nosotros les
30 minutes,
aseguramos que pueden
we
cocinar
ensure
una
that they
receta
can
totalmente
cook
variada,
a
completa, saludable y
recipe which is
nutritiva con
complete,
los alimentos que
healthy, and
nosotros les estamos
nutritionist
entregando en el
with the
paquete
food that
alimentario
we are giving
como
them
banco de alimentos.
as
Además, contamos
food
ya
package.
ahora con
We
cocinas
already
móviles.
have
Estas
mobile
cocinas móviles
kitchens.
se
These
trasladan a las
mobile
comunidades
kitchens go to the
para poder llevar
communities in
estos
order to
talleres.
be able to carry out these workshops.
Lo que les platicaba
What I told
sobre
you
cómo
about
desarrollamos
how
este
we
programa en
developed this
psicoeducación y en
program,
constructivismo,
uh,
tratamos de enfocar a que
in
no sea la
construction
típica
and real,
charla de
not to
nutrición
have
que ya
the
las personas
traditional
conocían y que de
conversation
pronto se
of
pueden llegar a implementar en otros
education of
espacios, sino queríamos que fuera algo
nutrition.
muchísimo más
We wanted
práctico,
something more
algo en donde pudieran
practical,
convivir,
something where
en
they
donde la
can
cocina fuera por
talk to each
placer
other,
y no por
that the
obligación,
kitchen
en
was
donde pudieran
something that
compartir
they
con sus
enjoyed,
vecinas, con
not
sus
an
tías, con su
obligation,
familia
that they could share
y que
with their
además también
friends,
nos
with their
pudieran
family,
compartir
with their
todas estas
aunts and
técnicas y
uncles, so that
conocimientos
they
que
can
tienen,
share
¿no?
all
Me
these
refiero a
techniques
ellas,
and
mujeres,
knowledge that
porque
they
la
have.
mayor parte de
I'm talking
nuestras
about women
participantes son
because the
mujeres, madres
majority of
cuidadoras o
the
madres de familia.
people
Sin
are
embargo, en
mothers
algunas
or uh,
localidades también
they
tenemos la
are
participación de
caregivers,
hombres hoy en día.
and we also have the participation
Cada
of
taller se
men
centra en
nowadays.
3 ejes, en
Each
donde muy
workshop has
práctico les
three
comparto, llegamos,
axles,
nos
and
instalamos, ponemos
we
las mesas de
arrive, we
trabajo
install, we
con
put
todos los
the
utensilios de
work
cocina
tables
y
with
una
all
persona que se
the
encarga de
kitchen
facilitar
tools,
estos
and a
talleres, que puede ser
person that
nutriólogo, chef,
facilitates
trabajador
these
social o una
workshops,
persona
which
que
are
esté previamente
a
capacitada
nutritionist
en
or
el programa,
chefs or
que
people who are
empieza a
trained in
facilitar
this
el taller
program,
de
and they
comer en familia
facilitate
y
the program
durante
of
los 30
Comer en
minutos que dura
Familia or
este espacio se
Eating with
empiezan a
Family.
arrojar mensajes
And we
en 3
start
temáticas.
receiving
Uno de ellos
messages
es
in
bienestar
three
en el
areas.
hogar, en donde
One
hablamos un
is
poco de crianza,
when we are
alimentación
cooking,
familiar,
we give these
Por
three
ejemplo, los niños no
messages:
comen la misma
well-being
porción
at
que un adulto,
home, for
el hecho de que
example,
no haya
and
distractores a
children
la
do
hora de
not
la
eat the same
alimentación, no estar
amount
viendo la
as an
tele, no
adult,
estar viendo el
not to
celular,
have any
no
distractions.
obligar a los
For
niños a
example, not
comer si
watching
no quieren
TV or the
comer,
phone,
buscar
not
formas
to make
divertidas de preparar
children
estos
eat,
alimentos y
to
demás.
look for a
Después
fun
tenemos
way
el
to
eje
prepare the
relación
food.
alimento y salud.
And
Lo que
then
estoy
we have
preparando,
the
cómo va a
relationship
impactar favorablemente en
food
mi
and
salud. Es
health.
decir,
How is it
si
going
estamos
to
preparando
impact
un
my
platillo
health?
que
If
lleve
I'm preparing a
espinacas y
dish
tomate,
that
las
has
espinacas
tomato
contienen
and
mucho hierro,
spinach
el
have a
tomate y
lot of
vitamina C,
iron.
entonces la absorción del hierro en
Tomatoes
sangre
has
va a ser
vitamin
mejor.
C,
¿Para qué? Para
so
evitar
the
anemia, ¿no?
absorption is
Entonces,
going to be
todos
good
estos
in order to
mensajes que de
prevent
pronto a lo
anemia.
mejor en la misma
So
comunidad o
maybe in the
nosotros en
same
casa ya
community
sabíamos
with us
preparar
at
las
home,
espinacas con
we have
tomate,
prepared
decimos el
spinach with
por qué
tomato,
es
and we tell
importante
them why
consumir
it is
y sobre
important
todo
to eat,
combinar este
and
tipo de alimentos.
especially to
Y
combine this
después
type of
tenemos las
foods.
técnicas
And then
adecuadas de
we have the
preparación de
adequate
alimentos, que es aquí un
techniques
poco les
to prepare
compartimos cómo
foods.
deben
And
de
here
cortar los
we
vegetales
are
para no oxidarle
showing them how
nutrientes,
to
evitar
cut
sobrecocer
the
los
vegetables
alimentos,
in order to
preferir el
preserve the
asado
nutrients, how
o la
to
cocción al
cook
vapor,
them,
todas
or
estas
how
técnicas que
to
van a ayudar
cook
a
them
optimizar
in
los
vapor.
nutrientes
And
de
all
los
these
alimentos que estás preparando.
techniques are helping us to protect the
Contamos
nutrients
con
in these foods.
instrumentos, uno de ellos es
We
el
have
manual del
tools.
facilitador, en donde
One
viene
is the
toda la
manual
información.
for
¿Para qué?
the
Para que alguien
facilitator.
pueda
It has all the
implementar los
information
talleres
so
de
that they
comer en
can
familia.
implement
Tenemos las
the workshop
recetas,
of
tenemos los
eating in
objetivos de
family
cada
or comer en
taller, los
familia.
ejes,
We
cada
have
uno de
the
cada de los
objectives of
24
each one of the
talleres
workshops.
tiene sus tres
The
ejes, los que les
24
acabo de mencionar, desarrollados por
workshops,
temática para
they
la
are
persona que
developed
vaya a
by
implementar
themes
durante un
for
año comer en familia en
for
las
the
comunidades,
persons
pueda
who are
tener
going to
su
implement this
manual y
program,
guiarse
have a
y poder
manual
implementar los
and
talleres.
to be
Y
able to
además
implement
tenemos
the
un
workshops.
recetario, el que
And we
pueden ver
have
aquí,
a
esta
recipe
caja
book, like
amarilla muy linda que contiene
this
39
yellow
recetas.
box has
Este
39
programa,
recipes,
digo, este
and
recetario,
this
perdón, se entrega
recipe
directamente a las
box is
familias
given
que
directly
tomaron
to
los
the
talleres al
families that
finalizar los
took the
24
workshops
talleres.
at the end of the
Contiene
24
recetas
workshops.
desde
It
platos
has
fuertes,
recipes from
ensaladas,
uh,
sopas, aguas
soups,
frescas
salads,
y demás. Y la idea de este
water
recetario es que se
with
lo puedan llevar a
fresh
casa
water
y puedan seguir
or water
preparando
with fruit,
los
and
alimentos
they
y
can continue
aprendiendo todos
preparing their
en familia.
food and learning in family.
El alcance del programa
The
hoy en la
scope of the
Ciudad de
program today
En México, perdón, está en
Mexico
39 de los
is in
59 bancos
39
que
of
conforman
the
la red. Hemos
50
capacitado a más de
banks.
1.500
We have
comunidades,
trained more
más de
than
1.000 talleres
500
impartidos y
communities,
hemos entregado más de
more than
40.000
1,000
recetarios.
workshops, and we have delivered more than 40,000
Y
recipe
bueno, justo lo que les
boxes.
comentaba,
And like I
tuvimos
was
todo el
telling you,
respaldo
we
académico de
had
una
the
universidad
academia
cuando se
support
creó
of a
este programa.
university. When
Se
this
realizó
program
junto a un
was
equipo
created,
multidisciplinario,
we did
sociólogos,
it with
nutriólogos, doctores,
multidisciplinary
psicólogos, para entender un poco
doctors,
más del contexto de la
psychologists,
alimentación.
nutrologists,
Hicimos
in order to
evaluaciones y
understand
diagnósticos a
the
cada una de las personas que
nutrition better.
participaron
And
y
each
obtuvimos
one,
resultados
we
muy
had very good, important
significativamente
results,
favorables,
and
es
they were
decir,
very
hay una
favorable.
tendencia en la
There
disminución
is
del
a
peso
trend in
y
the
el
decrease of
IMC
weight
corporal en la
and
población. Esta
in
disminución es más
body
evidente en
mass,
las personas que
and this is
acudieron a
more
más del
evident in
50% de los
people
talleres. Y ojo,
who
este no era
attended
un
more than
objetivo del
50%
programa
of the
como tal,
workshops.
pero indirectamente, desde que lo
Indirectly,
empezamos a
since we
implementar,
started
obtuvimos
implementing,
este resultado.
we had
El
these
programa tuvo un
results.
efecto
The
estadísticamente
program had
significativo en
a
la
very
mejora del
important
control conductual
result
y las actitudes
in,
favorables de las beneficiarias, así también
in
como
also
del comportamiento infantil cotidiano.
the
¿Por qué?
children's
Porque desde
behavior.
que las
Because
personas que
since
participaron
the
en los
people that
talleres
participated in the
empezaron
workshops,
a
since they started
implementar estas estrategias
implementing
en casa y
these
además también
strategies at
teníamos
home, and
participación
we
de los
also
hijos
had
e
the
hijas
participation
de
of
las
the
familias y
children
los
and of
fuimos
the
incluyendo en
families,
todo el
and
tema
we
de la
included them
alimentación.
in this
Al
topic
hacer
of
un par de diagnósticos y
nutrition.
estudios con
When
ellos,
we
también
did
vimos un cambio en la conducta
research,
prosocial
we
de los
saw
niños y de
a
las niñas,
change
¿no?
in the
La comparación de los
behavior
niveles
of
de
the
hemoglobina y de
children,
glucosa también
and
permitió observar un
also the
impacto
levels
favorable del programa, sobre todo en el estado
of
nutricional y la salud de las
blood
personas que participaron.
levels.
Entonces,
And
se puede concluir al final que el
at
programa
the end,
Comer en
we can
Familia tiene un
conclude that the
impacto favorable
program
sobre la
as Comer en
doble
Familia
carga de la
has
malnutrición, ¿no?
a
Tanto por anemia
double,
como por obesidad.
it
Y bueno,
helps you
Comer
with
en
anemia
Familia
and
tiene una doble
obesity.
metodología, lo implementamos
Comer
de
en
manera
Familia
presencial, pero también de
has a
manera
double methodology.
digital. A
Um,
partir de COVID
it
ya no podíamos llegar a las
Starting with
comunidades
COVID, we
con los
couldn't reach
talleres
the
de cocina, ya
communities
no podíamos hacer
with the
estos
kitchen
ambientes y
workshops, we
estos
couldn't have
espacios,
these
pero sin embargo
environments,
era
these
información
spaces.
muy
But
valiosa
it
que no
was some
podíamos
very
dejar de
valuable
compartir
information that we
con
needed to
los
share
beneficiarios,
with
entonces
the
decidimos
beneficiaries.
trasladar
So we
todo el
decided
programa de
to
manera
transfer
digital.
all
Entonces,
the program in
cada
a
semana
digital
compartimos
manner.
videos de recetas y de
Each week,
talleres en nuestras
we
redes
share
sociales, Comer en Familia, para que nos
videos
sigan
of
también y puedan ver
Comer en
estas
Familia,
recetas
and
tan,
they
tan
can see
deliciosas.
the
Entonces,
very
tenemos esta
delicious
doble
recipes.
metodología.
So we
Llevan
have this
los talleres de
double
manera presencial, pero
methodology.
a su vez
We
también
have
los llevamos
also
de manera
in-person
digital.
workshops, but we also have
Y
them
muchas
digital.
gracias.
And thank you very much. I apologize, she was going too fast.
Muchísimas gracias, Ana. Muy interesante, muy bonito el programa. Bravo.
Very nice
Tenemos a
program.
participantes que están aplaudiendo.
And
Afortunadamente tenemos preguntas en el chat, que nos da
fortunately,
mucha
we
alegría.
have questions in
Hay
the
una
chat.
pregunta para Lorena y otra
There's a
pregunta que es
question
para
for
ambas. Quizás
Lorena
vamos a
and
hacer la
another
vez para
question for
Lorena.
both of you.
La voy a hacer en inglés, como está formulada. Dice nuestra participante Elizabeth Robson. The presentation, your presentation is focused on fruit and vegetables. Oh, sorry, I lost the chat. Let me find it. Sorry about that. Okay, the presentation focused on fresh fruits and veggies. Are there initiatives with things like legumes and other nutritious food that may be unfamiliar? Thanks, Lorena.
Thank you for that question. Yes, this program is focused on produce, so fruits and veggies. However, there are other partnerships that the university has, let's say with the food bank, where they also provide dry ingredients. So let's say canned foods, legumes, and different types of foods that are uncooked that are very nutritious. And we also offer some classes to learn how to cook those, right? Because it can be intimidated to receive a bag of dried beans and not know what to do with those. But yes, thank you for that question. This program in particular is focused on fruits and vegetables, but there are other programs that offer access to dried goods such as legumes.
Thank you very much, Lorena. Tenemos una pregunta para ambas. Está en inglés en el
We
chat,
have
pero
a
la voy a hacer en
question
español
for
para Ana
both.
y para Lorena. ¿Cuál es la situación del
What is the
etiquetado de
situation
fechas de
of the
consumo
labeling
preferente
of dates
en
of
México? Y también puede aplicarse a
and
Estados
it could
Unidos.
be applied in
En
Mexico and the
Canadá,
United States.
esto genera
In Canada,
desperdicio,
this
ya que muchos
generates
productos que
waste
siguen siendo
because
seguros
many
y comestibles después de
products
la
that are
fecha se
sure,
tiran por
that are
precaución.
secure
¿Ves?
because
La
of
fecha de consumo
the
preferente no
expiration
siempre
date
significa
is not
que el
only
alimento
does
sea
not
bueno.
always not
¿Cómo funciona
does
en
not
México? ¿Cómo
always mean
funciona en Estados
that
Unidos?
they
Gracias,
are
Lorena.
already rotted
Sí,
or
en México también es un
yes, in
indicador
Mexico,
por el
this
cual
is
se
an indicator
desperdicia
why
alimento. Al
they are
final es una
wasting
norma y como lo
food.
mencionan,
This is a
es
norm.
un consumo
And like you
preferente. Sin
said, it's
embargo,
a
a simple vista,
preferential
ver un
use.
producto que tiene una
But if you
fecha
see a
en el que lo
date
debes de consumir,
in which you should
ha
consume that
generado más
product,
desperdicio de
it has
alimentos.
generated
Sin
more
embargo, es
food
bien
waste.
sabido que en
However,
México,
it's
mientras
well
que el
known in
producto
Mexico. If
no
the
pierde sus
product
características
doesn't lose
organolépticas, es decir,
the
sabor, color,
characteristics,
olor,
flavor,
el
or
producto sigue estando en
odor,
buenas condiciones, ¿no?
the
Entonces, si
product is
vemos
in good condition.
en algún
So if we
etiquetado que
see,
ya
for
esté
example,
próximo
a
a caducar
label
o
that
ese
it's
día
about to
caducó o
expire
próximos
or it
días, la
expired
mayor
or
parte
in
de
the
los
next few
alimentos tiene
days,
una larga
the
extensión de
majority
vida, ¿no?
of the
Entonces, cierto
products
tiempo
have a
y
long
si no
life.
pierde sus
And if
características, el
it doesn't
producto
lose
sigue
its
estando
characteristics,
pues
the
consumible,
product
óptimo para el
can
consumo.
continue being used or it's optimal for its use.
Should I reply in English or Spanish? In English? Yes, okay. Similar in the US, I think this applies to industrialized countries, right? One thing that I do want to mention is that there's a difference. Once the product is open, right, and it gets in contact with oxygen, that's when we have to think about food safety. But if it's a canned good and it said that it expired, let's say today, it has a buffer. I do understand the thinking behind it, right? Because you want to keep your population safe and you're providing a date. because we don't want to, we just want to be careful with food safety. However, if that product is a canned good and it's still closed, or it's shelf-stable milk that hasn't been opened, there is a buffer time that is safe to consume. And I also agree with Anna, like if the organoleptic properties are still there, it's safe to consume. It's a little bit different if you're talking about prepared foods, right? So if it's a fish, you might not know. It might still smell good, but maybe it's contaminated. So I would think about the refrigeration process. If you cooked it immediately and you froze it, that's good, around like 3 months. So it depends. And again, I'm sorry to promote ChatGPT, but like when in doubt, like it really helps brainstorm. So you tell it, I cooked this today, I froze it. For how long is it good for? And it can give you an estimate. It's a more educated guess than just saying like, oh, I'm unsure about this. I don't know if that answered the question, but yeah, that's what I do.
Thank you very much, Lorena. Thank you very much, Anna. I'm afraid we are running out of time, so I will stop here and I will thank you very much for your presentations, for your insights, for this amazing piece of information. We've learned a lot. And we'd like to invite the participants to scan the QR code that our colleague Eleanor will share on the screen to let us know what you think of the webinar and if you have interest in other issues, etc. And also remind everyone that you will receive an email if you cannot scan the QR code now, you don't have time. In that email, you will have a link to the survey, and you will also have the link to our CEC events page, where you will find the recording of this webinar in the 3 language and the presentations uploaded. And of course, as well, this recording will be on the website of the Food Waste Prevention Week. I would like to invite Eleanor as well to share the final slide from our side. So you see there another QR code and my email address so that you can contact with us whenever you want. And thank you very much, everyone, for your interest. And we will be very happy to get your questions or your comments by email or through the survey. And again, continue enjoying the Food Waste Prevention Week. We still have 2 days left, Saturday and Sunday, and there are so many things going around in the 3 countries to reduce and prevent food loss and waste. Thanks, everyone.